And most welcome of all our guest speaker in our dear Baghdad. Really, I want to say something. Early in the morning when I came and I start to listen to the nice, informative, comprehensive talk about the hypertension and the associated morbidities and the modality of the treatment, I say, oh, Nagham, what we will talk about? Because my talk today is completely different from the usual talk that we are learned to talk about it. But I want to say many thanks to Prof. Okka and to Dr. Abdussalam because they put many steps on the way as the introduction to my talk today. My talk today, it is the role of the doctor-patient relationship in the management of hypertension. Probably when we talk about the relationship between the doctor and the patient, we should put in our mind for every relationship, it will be in equal manner because there are two sides and the come and the take and the give, it will be equal. But I think this relationship, there is some bias, it will be on the side of the patient. So we will follow the principle of the customer always will be on the right. And when I will start to talk about my topics, I hope that I will be light and you will like the talk and you will accept what I will say. First of all, I'm Dr.Nagham Kareem. I am the Senior Consultant Interventional Cardiologist, and I'm here to say some talk about the topics that Have you ever wondered what makes the doctor-patient relationship so powerful? This is the question to my audience. And have you ever considered what you could do to strengthen this relationship to prevent it from failing or crumbling so that your job will be very easy? And have you thought that the consequence of unsatisfactory or adversarial relationship will give very negative feedback on you and or your patients? Okay, first of all, what do we mean by the doctor-patient relationship? If we want to define it as the usual definition, this is the consensual relationship between two partners. One will seek the medical assistance and the other one will agree and accept the other part as a patient. This is the definition. But if we return back to the ethics and to the principle of our job, this is the element, the core element of the ethical principle of our job, of our medicine. And when we start to deal with the patient and take him in consideration as a person, not as a cadaver, not as a symbol, not as a patient, we can reach to the point that we can manage him so satisfactorily in many points of view. Okay, what is the factor that's affecting the doctor-patient relationship? I think that this factor, it is biphasic. It has the negative effect on both the doctor and the patient, and it could have the positive effect. And this factor, it could be, it will be doctor-related, it could be patient-related, it could be system-related, and it could be doctor-patient mismatching. And I will talk about it. If it is doctor-related, it will be the career of the patient. Some of the patient, probably he is in the beginning of his career and he don't know how to deal with the patient. This will affect the relationship so much. And if we are talking about the patient factor, the new patient per se, it is very important because there is no more knowledge between the both person, and we cannot deal with him so that we cannot inform him, we cannot advise him, and we cannot put the exact medication and the management for the patient. The difficult patient, always, I think all of us, we can meet a difficult patient that it's very difficult to talk with him, very difficult to cope with them. And the patient with the poor prognosis, I think it is also sometimes difficult to deal with the patient because the doctor feels like the patient reaching the end of the rail and he cannot add more on the management of the patients. This is for the side of the patient. If we are talking about the mismatching, the language is very important. Sometimes the differences in the language between the doctor and the patient make the bridge between of them is very difficult, so that we cannot reach to the exact point that we should focus on it and that we need to treat it.
Dr. Nagham, you have 2 minutes, please.
You can give me another 2 or 3 minutes. If you don't mind, sir, because I'm the end of the
session is very important.
Okay. Time. And if we are talking about the system and the behavioral, cultural behavior, it is also very important. If we are talking about the system, the cost of the medicine and the time, it's very important, and the place, it's also very important. What are the modalities of the patient-doctor relationship? We have universally, there are 3 modalities. The first one is the active-passive model. The one will input the orders and the other should take it, respect it. The guidance cooperation models, this will be the second one, and the mutual participant model. This is here, there, while each of these have its specific medical specificity and each situation we can use one of them, but we see here that the new medicine, the third one, it is the most reliable one, and to take it in the management of the patients. What is the patient satisfaction? If we reach to the patient satisfaction, everything will be okay. So the patient, he feeling satisfied and he cope and he can be safe and confident about the doctor. Patient satisfaction is defined as the degree to which the individual regards the health care serving product of the manner in which it is delivered by the provider is useful, effective, and beneficial. I have just 2 more slides. How does the patient satisfaction affected by the patient doctor? The trust is very important to be between the doctor and the patient. The knowledge, if the patient know what he wants and the doctor, he know and focus on what patient wants, so everything is passing smoothly. And loyalty, it is very important topics. The loyalty that make the relation between the doctor and the patient, it's so smart so that the patient will forgive the doctor about any mistake, and the patient feel that the doctor will not leave him alone and he'll be responsible for him. And the regard, it's very important to be in between both sides.
Dr. Nagham, time is
This
finished.
is the last slide.
Thank you. Thank you.
Which factor? I said this is I mentioned it. Now the summary. The relationship between the patient and the physician is based on the trust, which give rise to the physician ethical responsibility to place the patient welfare above the physician own self-interest or obligation to others, to use sound medical judgment on patient behalf and to advocate for their patient welfare. And the doctor-patient relationship is a powerful part of the doctor's visit and can alter the health outcomes for the patient. Therefore, it is important for the physician to recognize when the relationship is challenged or failing. If the relationship is challenged or failing, physicians should be able to recognize the for the causes for the disruption in the relationship and implement the solution to improve the care. And thank you very much.
شكرا جزيلا دكتور.